Okay, so hopefully I am now presenting. So if you could just confirm that's up and visible for people.
Yeah, that's perfect.
That's great. Okay, so I won't be able to see the chat box, unfortunately. So if there are questions, kind of like either if Sue, you let me know, or if you want me to answer them at the end, I'm happy either way. So hello everyone. Thank you very much for the invite, Sue. I hope it's been a good Icon week so far. Certainly last night I took the opportunity to review some of the presentations, which are very handily kind of like on the website. So I was really intrigued, and I'd also panicked a bit about how I've put some bits in that have been covered already in some respects. But I think that's, when I come to it, you'll see is probably a good thing. And thanks for taking 30 minutes of your lunchtime, or whatever part of your day, to sort of join and sort of like listen to me talk a little bit about the partnership pilot that we did with Icon in Northwest Probation, and then a little bit more then really about kind of like our direction of travel really with Icon and the future opportunities that we see. And actually kind of, you know, reviewing kind of like some of those presentations. I watched the one which Laura Kefford and Monica Davis did, where they spoke about what they're doing in that partnership landscape down in Harrow, and I think it was Craig Johnson from SAFA about the work that they're doing. And it is kind of like, it's about those multi-agency, multiple touch points really, where we can reach to sort of like different audiences in different spaces through different means of communication. It's really important. So I shall begin and give you a bit of background. So my name is Tim Roberts. I am the Health and Justice Partnership Manager for the Probation Service in the northwest of England. So I'm just going to start by explaining a little bit about my role and where we came from and how we kind of like fit into the whole health picture. So the Health and Justice Partnership is actually derived out of what is called the Harm to Hope strategy, which is a 10-year government plan to cut crime and save lives, specifically around the substance misuse agenda. So you will probably have seen kind of like both in the headlines recently around kind of like Glasgow getting clearance to be able to do their first kind of like public drug consumption room, and all of the initiatives like that are a response to the number of drug-related deaths, overdose-related deaths that are happening in our communities. And a large proportion of those people are involved in the criminal justice system in some capacity or have been. And so this harm to hope agenda kind of like was brought in to look at increasing capacity in the treatment system, to reduce supply and cut demand essentially. So a wide-ranging review, government white paper by Dame Carol Black, culminated in a series of 32 recommendations, which was like very, very forward-thinking, very brave, very kind of like revolutionary, really, in terms of our national drug strategy and our approach to substance misuse treatment and support. And unusually, all 32 recommendations actually got approved, have been acted upon, and there's been, government funding to support that. And those measures range, in the community, from needle exchanges to housing options. There's test on arrest is being restored with the police, but crucially really is increasing capacity and trying to return the workforce to pre-COVID and pre-austerity levels. So then probation kind of like have taken a new approach towards health and justice. So as part of this national strategy, there is a team in the Northwest of 5 specialist coordinators who are health and justice partnership coordinators, and they link the probation service and the people on probation up with the prisons, with health providers, with third sector specialists, and internally within our own probation landscape to benefit people on probation, to improve their health outcomes and their life outcomes. So we have a person for reference, because this will be up on the website afterwards if you wanted to get in contact with anybody to discuss it in any greater detail. A person in each of the regions or the counties, larger counties in the Northwest. And then we have a lady called Sarah Stocks, who covers everything relating to the female estate across the whole of our region, and then myself kind of like overseeing what we're doing and who we're talking to, and trying to create new initiatives and break into new ground. And just in terms of that, vision that the government have around it. This is kind of like the three prongs of their strategy, and I just really want to draw your attention really to the third one there, which is health inequalities. And that's kind of like a really important aspect for us. You know, we kind of know what we're doing in terms of substance misuse. We've got lots of support, we've got lots of plans and work that we're doing, but actually it's the wider kind of like health vision that we're trying to address as well. And we're working very closely with NHS England around their core 20+5 agenda and those 5 key strategic areas where they are trying to deliver kind of like health interventions to the 20% poorest in the population who don't necessarily get equitable access to health. So with that in mind, the probation service and health provision, for those of you who don't know, so just a bit of background about the probation service. So we're kind of like sometimes a bit like the prison service, a bit of a hidden service within kind of like the bigger landscape, and actually kind of like the work that we do revolves around improving people's lives, helping people to rehabilitate resistance, and a huge important function. Again, you will have seen kind of like there's been quite a lot of noise in the press recently around kind of like the pressures on prisons, the pressure on the probation service, but one of the key functions is protecting the public. And actually, so a probation practitioner within a probation delivery unit where that work is done, they hold a lot of responsibility for the successful management and oversight of a person on probation's community order or license, and that actually is so wide ranging. It doesn't sort of sit exclusively with their criminogenic needs. It actually has everything to do with their personal, their social, their community capital, and actually trying to manage the risks associated with those deficits in those areas and the unmet needs around them. And health can be a real key determinant in a person on probation's outcomes. And it will come as no surprise to people that, a lot of people that we work with, suffer with a variety of different mental health conditions. There is substance use quite often is prevalent. We work with a lot of people with personality disorders. A huge proportion of the prison population, I think it was up to about 65%, 70%, either have a diagnosed or an undiagnosed neurodiversity or a learning difficulty. And then it's simple things that kind of like, none of us take for granted, but kind of like most of us are equipped to be able to kind of help ourselves with are things like, GP services and health education. We're currently kind of doing a bit of a health needs assessment here in the Northwest, just in Liverpool currently, around the number of people who are perhaps on probation who aren't even registered with a GP and maybe haven't been for kind of like a considerable amount of time. And all that builds into this big picture of kind of like, the recovery capital that we're helping to deliver into people while at the same time trying to manage those risks. And then who's actually on the probation caseload? So currently, there are about 243,000 people who are being supervised in this country by probation. And if you just take that in the context of kind of like the prison population, which currently sits at just under 88,000 people, of which 3,500 are female, so that's roughly 4%. It's a predominantly male audience that we work with and talk to. You can see I've put underneath that the judiciary work really hard to find alternatives to custody for females. There's endless amounts of evidence that says that kind of putting females into prison, especially if they have children, there is no benefit to it. There's no improvement that kind of like that can be gained. So it's only kind of like a small proportion of females that will be put into prison based on their risk to the public. And then this kind of like chart that's with us on the right kind of like just indicates sort of whether or not they are in what's called post-release supervision. So that means that they are supervised in the community after they've been in prison, whether it's pre-release supervision, so maybe kind of like before they're going into custody, If they were on remand, we've got suspended sentences, and we've got community sentences. And community sentences are those who people who are never going into custody. Their entire kind of like commitment to the criminal justice system is served in the community. And these are all touch points for us, kind of like to talk to the audience that we have kind of like identified. And what I just want to kind of like highlight as well, really, around kind of like the work that the probation does, like the relationship between a probation practitioner and a person on probation is a really kind of like critical one, because the conversations that are had ranging across those that big broad sort of spectrum really does kind of like allow people to be vulnerable and to ask questions and to be honest. And you know, the work that gets done is really kind of like close knit, and you do see kind of like strong relationships built up between probation practitioners and people on probation. So it again reinforces why this partnership working is really important for us to have the tools to deliver. So next chart is just some statistics for you to consider if you're in a Philip professional service like ourselves. And this is when I said that there's some repetition. So 70% of babies are shaken by men. And I put that, I don't mind repeating that stat because it shows kind of like, you know, that message is embedded, you know, it's getting through in the right way to the right population. In terms of kind of like a lot of the people that we work with, you know, from a kind of safeguarding adults and children perspective, you know, we work with people who are in some way kind of like within their needs is the toxic trio. There's domestic abuse, there's substance misuse, and there's mental health issues, which greatly increase the likelihood of an adult committing child abuse or neglect. And sort of just in terms of what we do in the health and justice team, we are trying to drive up the use of what are called CSTRs. They are community sentence treatment requirements, and they are kind of like an option for an alternative to custody, where education and training can be provided to sort of fill that unmet need, to fill that gap of knowledge. So, you know, we work closely with substance misuse providers and mental health providers to create bespoke packages of care and information to help people address their thinking and behavior around those areas. And the other thing that's worth noting is people on probation are more likely to have other factors which kind of like increase the likelihood of incidents, such as financial insecurity with lack of employment, legitimate means, again, health inequalities, the lack of access to services. My previous role, I worked in a sort of through the gates kind of release suite, and you know, the number of people who would come out and just didn't know where to go for help, didn't know where to go for information about various aspects that they might have had identified in custody, but didn't know how to sort of like then act on it. And there's definitely kind of like a huge gap and in ability to access services, and then quite acopic reactions to it as well. And then social isolation, you know, having been in custody for long periods of time, or actually just not feeling part of communities. And it's an interesting question because, you know, quite often in criminal justice terms, we talk about reintegration. So, you know, people being reintegrated back into communities. Well, you know, you can flip that on its head and say, actually, kind of like quite a lot of the people that we work with have never been part of the community. So it's not about reintegration, it's about integration, full stop. So that social isolation is people who just aren't connected to the normal sort of like channels. So what did we do? The pilot. Warrington Probation linked up with ICON, and sadly the engagement began as a result of a serious case review which Probation were part of in the Warrington area. But that linking up began, and so what was decided was Warrington and Halton were going to come across, and they were going to deliver a series of online briefings across the Cheshire region. This was done in July 2022, and all the practitioners took part in that who were in post at the time. And then as a result of it, they went away. They were asked by kind of like the senior management to review their caseloads, to identify parents or partners of new parents, and to deliver the ICON intervention to them where possible and appropriate. And from that, initially there was a really good uptake, and while the training was fresh, there was a lot of positive response received, and I'm going to show some of that on the next slide. But what has been identified is, with the turnover of staff, and that knowledge, awareness and understanding across practitioners needs to be reviewed and refreshed with greater frequency. So again, I'll come on to sort of like some of our future plans around that, but we recognised that we needed to embed something a bit more concrete across the whole of Northwest Probation to make sure that ICON remained kind of like on the agenda with that particular cohort. So this is some of the practitioner feedback, and like you might sort of view it kind of like and go, well, that's not particularly kind of like positive, but actually when you think of it in the context of the people that we're working with, the position of mistrust that they quite often come from in terms of, engaging with services, and how difficult those conversations can be in terms of saying kind of like, look, you're a new parent, this is some information that you might think is useful for you. There's always a bit of hesitancy. So I personally think you can read some of these. I carried out the ICON intervention, pretty interested in this, especially the part about being able to leave your baby for a short amount of time in a safe space, as he thought he would have to be there all the time no matter what. Baby isn't born at this time, so the impact isn't seen, but the session seemed to go down well. Jay attended for ISPIV today, and so I delivered a short input on ICON. Baby due 4th July. Given the leaflet and information posted to take away, he stated that Mum would not thank him for the leaflet. He is keeping it as a reference for him, so we will have the awareness and info should the subject ever be raised. The info was new to him, and I think that's a really kind of like insightful and positive response. And then ICON was delivered to DB as his partner has a young baby. He paid attention, was interested, and took the leaflets and said he would show his partner. So all kind of like good responses on that page, in my opinion, because to actually get the buy-in to have an intervention delivered in the first instance is really difficult. So kind of like the fact that it's been delivered and we're getting these kind of responses is great. So then it's about what we do next, because we don't want to leave it at this point. So our head of the Warrington Probation Delivery Unit, Terry Bendon, who initially set this up with Sue, presented an options paper to our regional board. And so what we're currently looking at now is like region by region training, dependent on the availability of ICON trainers, but with a long-term ambition to then train the trainers with some regional reps that are embedded across the kind of like Northwest landscape, so that we have that permanent resource to keep on retraining staff as and when they kind of like join the service as part of inductions, etc. Important was for us to gain consensus that it's a necessary part of our commitment to public health approach and prevention of harm strategy. So that was signed off. We've also kind of like looked at building it into, and I think this is actually now built into our guidance of what are called non-approved rehabilitative activity recovery. And that means it's a non-structured intervention, but it's one that kind of like, if it can be used as part of kind of like that person's commitment to a set number of hours that they might kind of have to deliver to sort of the probation service in terms of activities that are meeting kind of self-improvement, personal development, change, etc. And what we also have made sure that we have in place is that we have wellbeing check-ins given to all of the staff that this training's delivered to, pre and post, just to make sure that all staff feel supported around what can be quite impactful nature of the content of the training. And then just to wrap up, really, how are we looking to develop this beyond kind of like just embedding it within the practice here? So he is making use of our digital assets. We have, we've got an extensive Teams network here with lots of different channels. And so we want to get this embedded into our L&D channel for a service-wide resource, so we've got a permanently available training module. We can also look at our offender behaviour programs that address thinking, attitudes and behaviours, such as TSP, building better relationships, new strength. And these are, again, they're touch points where at the beginning or an end of a session, you know, an icon intervention can be delivered whilst people are in that frame of mind around learning and change and discovery and different ways of doing things. And then also just embedding it outside of ourselves in other what we call commissioned services, so CRS provision. So we have like a personal wellbeing service that's delivered for us. We have CFO activity hub programs, and we do lots of health promotion days in probation centres to try and, you know, improve that engagement with health services. And then a really kind of like important one, which is taking a bit more work because it means that we're reaching into the custodial setting. But clearly kind of like there's a huge kind of possibility and option there for us to be able to talk to an audience of kind of like fathers who may not have sort of met their child yet. People who maybe kind of like have gone into custody since their partner fell pregnant and are coming out, and helping to manage those expectations and have those conversations. My background prior to this, I worked and managed a drug service in a prison, and, you know, throughout that time, numerous people would, you know, be talking about what they were going to do when they got out because they had a new baby and like everything was going to be different. And actually kind of like, you know, this training can be rolled into those sorts of health conversations and helping people to learn and manage some of the expectations when they come out. And as part of that, widespread distribution of like the physical and digital information that's available through ICON in the criminal justice system. You know, the videos that I think it was Joanna Garston showed, that they could easily be on Way Out TV. They could be on kind of like reception rooms and waiting rooms in both, you know, probation offices and healthcare units in prisons. So there's a huge potential for us to keep looking at ways of developing this. And so thank you. Thanks for listening. Oh gosh, that one's a spinner. Thank you for inviting us to share the work that we're doing with ICON and supporting us to bring the ICON message to the wider partnership population.
Thanks, Tim. That was great. Thanks very much. And obviously we approached you and looked at working with you because, as you've said quite rightly, and it'll be said again during the week, that 70% of perpetrators are males, and as we're hearing this week, that's what our theme is: how we can ensure that we're sharing the message with males, and majority of your population are male. So some great ideas, different opportunities of when to have those conversations and ensure that they're prepared for if they're going home to new babies. I think it's really valuable. And using the videos again, like you say, have them, lots of people put things on GP screens in waiting rooms, and those videos that Joanna Garstang's created are fantastic. And there's also lots of other little animations and videos that you can use from ICON as well that have got the writing on them as well, so they can be used if you can't play the sound. So that's fantastic. Has anybody got any feedback, comments, or anything, or is anybody thinking about probation or the justice systems within their areas? And you know, it is quite a new thing, like I said to you, Tim, that we're just starting out with you. So hopefully people will watch this and come to me and say we'd like to get on board with that, and we'd like to share that ICON message within our areas. I think it's a great opportunity.
Absolutely. My contact details are on that end sheet. So if anybody does want to get in touch, then just let me know.
Yeah. Oh, somebody's put a comment in the chat.
I don't know whether there is with ICON, Elaine, but I can link you up with the Health and Justice Partnership team in the Midlands. They do have, I think in the same way as we do, they have a coordinator for every kind of like county as well as for females. And so I can quite easily get you linked into the right people for those conversations.
Thanks, Tim. And Elaine, so all areas that have commissioned ICON have an ICON lead, and this is how this started. So they have like a national a meeting usually and discuss what's going on nationally with ICON. And the process, it starts with health, and then it snowballs out into probation, the police, social care, lots of different areas. So I can let you know, obviously, what area are you from? The Midlands. I can send you who your icon lead is, and we're just starting this journey out, and hopefully by learning Solihull, right? Yeah, I can send you who your lead is, and we can start having those conversations, which is hopefully, you know, people will see this presentation and want to get those things started to be set up and the training in the systems. So that's brilliant. Thanks, Elaine. And Tim will I'll share some contacts as well. Anybody else got any comments? It's like after every presentation, as I say, I'll put the link in for the evaluations, just literally a couple of questions, just so we know where we're up to. The session will be on the website for you to let your colleagues know, listen to, find out more information. If you've got any questions afterwards, email me. I can put you in touch with Tim. No problem at all. But that was brilliant. Thank you, Tim. And hopefully by next year, we'll have a lot more areas, obviously sharing the icon message as well in probation.
Definitely. More
Thanks,
coverage.
Tim. That's brilliant. Thank you. Well, thank you, everybody, and thanks for sharing your lunchtime with us. So our next webinar is this afternoon at 1 o'clock. Well, in about half an hour, but that's with Karen Lee and Monica Davies, and they're going to be talking about mesh and icon. So hopefully we'll see you all then. Thank you all. I'll hang around if anybody wants anything. Thanks, Tim.
No worries. See you soon.
See you
Thanks
later,
soon.
Tim.
Bye.